Ladies and gentlemen, good morning, everybody. This is Riccardo Bertolo from the UROONCO platform Kidney Cancer. Today we have the pleasure to have with us Dr. Crivellaro, who is professor and director of minimally invasive surgery at University of Chicago, Illinois. Since the advent on the market of the SPE platform, a purpose-built robotic platform dedicated to single-port surgery, he has become one of the key opinion leaders all over the world at performing surgery with this machine. And today we have the privilege of having him for addressing question and having his insights about this one. So, first question for you is about the penetrance of the system in your institution. So how many surgeries are you performing with this novel platform, which is the percentages between the multi-arm robotic surgeries and the single-port robotic surgeries?
Thank you very much, Riccardo, for having me. This is a very good question. Most of the surgeons in the United States, they started using the single port for certain cases, and they've been doing what we call cherry picking. Personally, I decided to go in a different direction, and I went all in. So right now, since 2018, December 2018, all my robotic cases are single port.
This is very nice. So which are the advantages you perceive with using this platform? Which are the differences, the technical issues you experience since the beginning of the learning curve?
I think single port is just the evolution of robotic surgery in the same direction. I mean, the goal here is to minimize minimal invasive. We're miniaturizing the technology that we have available. This robot has a much smaller footprint. The advantage is that we can actually access small anatomic spaces much more comfortably than we could with the multi-port before.
Okay, and now let's focus on kidney cancer surgery. So which are the technical differences you perceive, for example, in suturing during partial nephrectomy or in approaching the kidney cancer, whatever the kind of surgery?
I believe partial nephrectomy is probably one of the best indication with the single port. In terms of technique, the technique itself is not any different. We still perform the same kind of dissection, enucleation or resection. We still do the suturing in the same way. The articulation of the instrument is a little bit different. It's not at the wrist, it's at the elbow, so that requires a little bit of adjustment. But the main change and the big shift is the fact that you can efficiently use the single port retroperitoneally in pretty much every partial, or in general, in every kidney surgery that you have to perform.
This is very nice. In fact, the next question was about the retroperitoneal approach to partial, which ideally should be the more natural, the more physiological one. So I guess that you see that you feel that this will help in expanding the indication of the retroperitoneal approach to partial nephrectomy.
Yeah, I strongly believe that retroperitoneal robotic surgery has been there for a long time, but it never got popular because with the multi-port, it's hard, it's difficult. Single port, what I always say is democratize retroperitoneal approach for kidney surgery, which I think is the more natural. I mean, kidney is a retroperitoneal organ after all, and it carries a lot of benefits for the patient. With the single port, we can use a particular approach, which we call SERA, which stands for single port anterior retroperitoneal approach. And essentially, we make a small incision at the level of the McBurney point with the patient supine, and from there, we access the retroperitoneal space. And that approach is a one-stop for surgery all along the urinary tract, from the kidney all the way down to the ureter and the junction between the ureter and the bladder.
Seems like a very anatomical one. Thank you. So last question for you. It's about how you envision the landing of the platform in Europe. We look forward to have this platform available on the market of Europe too.
Yeah, it's been a long time and it will come. I think European urologists, they are very curious. They are willing to go through learning curve to learn new technique. So I believe SP is going to have a bright future because being European myself to start with, I know that the European community of urologists will embrace it and they will make a very good use of it.
Yeah, we look forward to have this further instruments available. Thank you very much, Professor Crivellaro, for sharing your experience with us. Thanks everybody for joining us in this interview.